What is pulsus paradoxus? In healthy individuals, the amplitude of the pulse decreases during inspiration, which lead to decrease in systolic blood pressure during inspiration, which is usually less than 10 mm of mercury. This decrease in systolic blood pressure during inspiration occurs because of increase in negative intrathoracic pressure. As there is increase in negative intrathoracic pressure during inspiration, the venous return to the right side of the heart increases. As the venous return to the right side of the heart increases, the interventricular septum will impinge itself on the left ventricle, and now there will be less blood accumulating in the left ventricle, which in turn will lead to reduced stroke volume and decrease in amplitude of the pulse during inspiration, and reduce in systolic blood pressure, which is normally less than 10 mm of mercury. Pulsus paradoxus is nothing but an exaggerated normal response where the systolic blood pressure decreases more than 10 mm of mercury during inspiration, and it occurs in a condition that is cardiac tamponade. Cardiac tamponade is a condition in which the pericardial pressure becomes more than the diastolic filling pressure, and as the pericardial pressure becomes more than the diastolic filling pressure, the ventricle cannot be filled properly, and during inspiration when there is more venous return to the right side of the heart and the interventricular septum impinging itself on the left ventricle, and further there is constriction of the pericardium or the increased pericardial pressure which is not allowing the left ventricular to expand, will lead to more decrease in the stroke volume, and sometimes the stroke volume is decreased to such an extent that the pulse may not be even palpable during inspiration, and the systolic blood pressure will decrease more than 10 mm of mercury. This is known as pulsus paradoxus, which occurs in a condition that is cardiac tamponade. How to measure for a pulsus paradoxus? We start measuring for the blood pressure, and the appearance of the first Korotkoff sound will be heard only during the expiration, as because during inspiration the Korotkoff sound will not be heard because the stroke volume is reduced to such an extent that the Korotkoff sound will not be produced because of low pressure in the arteries. We start deflating the cuff more after hearing the first Korotkoff sound only during inspiration. We start deflating the cuff. There will be a time where the Korotkoff sound will be heard in both during inspiration and during expiration. This is the time where the stroke volume is sufficient enough to produce Korotkoff sound. The difference between the first point where the Korotkoff sound was heard during expiration only and the second point where the Korotkoff sound is heard during expiration and inspiration both is defined as pulsus paradoxus. And if this difference is more than 10 mm of mercury, it is said that the patient is having pulsus paradoxus, which occurred in a condition that is cardiac tamponade.